started with an introduction. We still have participants joining, but at a slower rate. So I'll just start with my introduction and let everybody join in. So good evening, everybody. I'm Paola DiCicco. I'm a naturopathic doctor sitting in my office here on the west end of Montreal. And I've been in practice since 2004. I've been in this office since 2005. So I've been in practice for about 20 years. I think this is my 20th year. And I've had the absolute honor of working with over 5,000 patients. So I've seen a few things in my 20 years of practice. My practice very much does vary in the sense of where I will see all kinds of health conditions ranging from irritable bowel syndrome to anxiety, depression, to digestive challenges, all types, to immune challenges of all types. And then we get into the more complex stuff, which I really do a lot of work in, which is with regards to environmental medicine and integrative oncology. I'm just going to have a look. I've got someone in the chat and in the Q&A box, so I just want to make sure that it's not a technical thing. Hi, Sherry. No, there are no handouts for the webinar that I'm aware of. And yep, so that's the same question twice. So no, not that I'm aware of. So I'm hoping that everyone can hear me just fine. I'm holding up my microphone because that can help. So if there is an issue with the sound, please pop in a note to the chat or the Q&A. So as I was saying, my practice is incredibly general. I see all ages, all health conditions. I have two areas of focus. One is environmental medicine. So I'll see and work with a lot of individuals whose health is extremely challenged by things like mercury or lead or aluminum exposure, mold, toxicity, chronic infections like Lyme and co-infections of that long COVID, et cetera. And I also do a lot of work in integrative oncology. So working with patients at all different stages of their cancer diagnoses in conjunction most of the time with their conventional care, and to see how naturopathy can really support them in their journey along with their conventional care, if that's the case. So that's a little bit of who I am and where I am. And I'm really happy to be here with you this evening representing Atrium for Healthy Planet. And that being said, one last little order of business is with regards to disclosure of conflicts of interest. I am a remunerated lecturer and advisor for Atrium Innovations. Otherwise, that's it. I'm in private practice and I do my thing, and there are no other conflicts of interest to discuss. So as you're aware, as we saw, today what we're going to be talking about is really the cold and flu season with regards to ester C, which is a specific type of vitamin C. And so it's very timely because it is the end of October. And so many individuals have already started with the cold and flu season, unfortunately, and November's right around the corner. And that tends to be a month where it really accelerates. Something to keep in mind is, especially with regards to kids, we'll often see significant cold and flu symptoms that kick in 48 hours after Halloween, say Valentine's Day, Easter, because of the incredible amount of sugar intake. So don't forget that a high sugar intake can really suppress the antiviral component of the immune system for a good 48 hours. And so if you are getting yourself ready to go trick-or-treating or Halloween parties, or you're getting your kids ready for Halloween parties and trick-or-treating, then you definitely want to hear what we've got to say tonight, and maybe stock them up with some of this ester C to try to counterbalance the weakening that's going to happen in their immune system because of all of the chocolates and sugars that they're about to eat. So not that I'm promoting that in any way, shape, or form. As a mother of two myself, I am just reflecting what are the cultural norms. And so chances are many of you who do have kids are going to be out there trick-or-treating and eating their candies. So this would be an important lecture for you to listen to. So what are we going to look at tonight? Tonight, we're going to first of all establish that not all vitamin C's are created equal. And in all honesty, up until not that long ago, I don't think I would have had this same opinion. I would have said vitamin C is vitamin C. It's, as my teenage daughter would say, it's not that deep. It's not that complicated. Vitamin C is just a standard vitamin, ascorbic acid, whether you take it in liquid, powder, or capsule form. It is what it is. And what we're going to see is actually that's not the case. There is quite a difference between the more typical vitamin C known as ascorbic acid or a buffered version of that compared to ester C. And I'm really excited to take you through some of that research and some of my own personal experience, let alone the clinical experience that will help ring true to that and bring that home a little bit on how the ester C is different. What I'm going to weave through this whole talk, including the next slide coming up, is a little bit of a crash course on the immune system. And what we usually do is we refer to the immune system as one thing, the immune system, with this misrepresented vocabulary that the immune system is one thing, it's one unit, and it just behaves in one way. And actually, that's really far from the truth. What we see is that there are a number of different components to the immune system, and they can either act independently or in function of the other. And it's about looking at what's going on with the different aspects of the immune system. One might be high, the other might be low, and how that can really create an environment for different immune-related challenges, whether it's catching every cold and flu that passes, or whether it's having an inflammatory issue like eczema, or an autoimmune issue like Hashimoto's thyroiditis, or rheumatoid arthritis, or even to the point of where there's a cancer issue. Because as we know, we're making cancer cells all the time. Our body is equipped with a number of checkpoints and garbage cans to dump all of those cells into the garbage bin. But if the immune system is not effective in its clearance of that, then we're going to probably have some problems down the line. So that's our second point, where I'm going to weave in throughout the talk just FYI information about this is how your immune system works, and this is how it may be relative to you and health issues that you may be going through or your loved ones. And at the end, we'll look at some real life case scenarios to try to tie in together. Okay, we're going to talk about the we're going to talk about the theoretic in the next coming slides, but how does that translate into the practical when I'm showing up with certain types of symptoms? So that's generally what we're going to cover today. I do tend to take many tangents and go into all kinds of different sorts of explanations and stories and metaphors. And so I'll always try to come back to the point at hand, which is colds and flus and vitamin C. In terms of colds and flus, what I consider to be a healthy immune system is to get a cold or a flu once a year, maybe even twice a year, but that you're able to shake it quite quickly and the symptoms aren't extreme and they don't last really long. So especially, and it depends on your exposures. So if you've got young kids who are at daycare or at primary school, if you are working in a close environment with many other individuals, if you're working in a poorly ventilated environment, these are going to be different realities for different people that will influence how much they're exposed to viruses and to bacteria. So if you are working from home, you don't have young children, you've got a small social network that themselves don't have high exposure rates, then it would be understandable that if you get 0 to 1 cold or flu a year. However, if you do have some of those other elements we talked about, kid in daycare, working in really close proximity, then maybe you'll pick up a few more during the cold and flu season, fall and winter. However, the idea is not, I'm just about to get over something and bam, I'm getting hit again. Or I catch everything that crosses. Or my partner had a cold, they were down and out for 3 days, but 10 days later, I've still got, my head in a pressure chamber where I've got crazy sinusitis or I'm coughing nonstop. These are indicators that maybe your immune system is not in the shape that we would want it to be and leaves a vulnerability for having a tough time with infections. So we're going to look at how ester C can help with that. In terms of looking at the immune system and taking it from a big picture perspective, this is a very busy slide with a great deal of information. I will leave this in your hands to look up and to look at. You can do a little print screen or take a little snapshot with your phone, and you can really look into this on your own. Basically, what I'm going to ask you to do is to just hear me out, okay? So what I've got in my hand is a pen. let's pretend that this is the seesaw at the kids' park. Okay, so we know that the seesaw will go up and down depending on the weight. Well, instead of having two people sitting on each end of the seesaw, we're going to have two different components of your immune system. Okay, group 2 and group 1. So group 2, like it says on the slide, are your T helper 2 cells, and group 1 is your T helper 1 cells. Now, these are subunits of your T cells. The idea is that these two components of your T cells, these two groups, are generally in balance. Okay, not a big deal. One will go up a little bit, the other one will come down, but they're generally going to stay in balance. Now, what can happen for a number of reasons, many of which are in the slide, and some of which I'll share with you in a moment, this can happen. What that means is that the 2 group is too high, and the 1 group is too low. When your 1 group is too low, that leaves you open and vulnerable to catching viruses, because this is the antiviral part of your immune system that is out there scavenging for if there are any kinds of bugs like colds and flus responsible, the bugs that are responsible for colds and flus, they're monitoring all that. So if this part of your immune system is too low, then it's going to do that ineffectively, leaving you at a greater vulnerability to catching stuff. On the other end of the spectrum, if your group 2 is too high, this is what's going to drive inflammation. So what we've got is what we call the typical triad. That's in the big purple star in the lower right-hand corner of your slide. That overdrive of inflammation will frequently be seen as asthma, eczema, allergies, sinusitis, upper respiratory infections, urinary tract infections, just this constant inflammation. And then if that keeps progressing, then often that will include autoimmunity, which you do see also in your slide. So the question is, well, if the balance is supposed to kind of be jigging like this, what makes it do this? And there are a number of reasons. Stress, the bugs in your gut, known as your gut microbiome being out of balance, environmental toxins like mercury from our amalgam fillings, lead from water piping, mold toxins. Keep in mind that 1 in 4 residential and commercial buildings in North America are mold toxic. Don't forget that at least where I live in Montreal, unfortunately, we still have a large, significant number of water pipes that are lead-based. We actually had a study a couple of years ago done by McGill University's Environment Department that showed that approximately a quarter of primary schools the water from their water fountain was at a higher than acceptable level according to provincial standards of lead because of lead piping. So the reason why I'm sharing these statistics with you is for you to not have this idea, this illusion that we live in a first world, comfortable, affluent, abundant country, and therefore we don't have environmental toxins to deal with. That is very far from the truth. As you probably know, if you're here at this talk, then there's some kind of interest, most probably along those lines. Other toxins can include things like glyphosate and pesticides, which are really not fun. What we also have to remember is another big piece of what drives this imbalance, and it's right in the middle of your slide, is stress. So whether that's the constant day-to-day grind, the constant multitasking, the constant running against the clock, the constant never-ending to-do list, the not enough sleep, the too much work, the difficulty in establishing your boundaries, that's the day-to-day stuff that's going to drive this. On another level of stress, we can have PTSD. That's going to drive this. So why I'm taking these extra few moments to talk about the stress is because it's so important. I see this in clinic all the time. I can identify the bugs in the gut that are out of balance and treat that. I can identify a elevated aluminum body burden and chelate that out. I can identify if there's Lyme disease and work to address that. And we can really show in tests before and after that we've cleared out those loads that are insulting the body and pushing symptom manifestation. However, once those loads are gone from the body, we can still have ongoing symptoms because the stress cycle has not been addressed. So it can really take a lot of work to invest in some self-care when we need to work on our day-to-day stress management and also potential PTSD. So that self-care can include guided meditations, mindfulness practices, spending some time where you're looking at green, right? And I'm not just talking about painting your wall green, but what we see is that because of our evolution and in our brain, when we're walking in a green area, so with lots of trees, that visual of the green actually sends a message to the survival part of our brain to say, it's okay. We can calm down the stress response. So just a little bit of food for thought there. Before we move on to the next slide, I'm just going to have a check because something came in the Q&A, and I want to make sure that it's not something that is tech related. So Ma is asking, what's the difference between Ester C and Ester C Supreme? I'll see if we get there. We haven't even started our talk about vitamin C. So I'll do my best. And if I don't have the answer in the slides, then I'll try to take a moment and look at what are the two different formulas, because I don't have all the details of every formula that I use in my brain. I have my own dispensary or pharmacy here at the clinic, and we use about, 200 different types of supplements. So we'll have a look if it doesn't come up in one of the slides. All right, let's get to it. So vitamin C. Why is vitamin C so important? It's so incredibly important. And so what you see highlighted in yellow are just some of the physiological functions. So it's incredibly important for the immune system because it improves the function of our white blood cells. So our white blood cells you can see as being kind of like our surveyors. So those are the cells that are just constantly moving around in our lymphatic system, checking out to see if there's anything that they need to fight against. We also see that vitamin C is an incredibly important antioxidant. So an antioxidant is basically something that quenches a free radical. Free radicals are things that are generated through inflammation, environmental toxins. So we're generally creating free radicals all the time. And they are like a pinball. So, like a pinball machine when you're hitting the sides and the ball goes bing, 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 bing. The ball is your free radical. And it's radical. It's just this, kind of crazy teenager. And every tissue that it touches, it's going to create a little bit of damage or inflammation. Not that that's what teenagers do. I love my teenage daughter. But that's kind of the idea of a free radical. And vitamin C just goes and says, no, settle down. You don't need to be bouncing around and damaging tissue. So one question I often get about vitamins and minerals is, why would I need to take a supplement if I have a good diet? That within itself is at least an hour-long talk, but just to hit a couple of quick points on that. One, as many of you probably know, the quality of our soil has degraded immensely over the last couple of decades, where our soil is not nutrient dense like it used to be. So what that means is that our food doesn't have the same vitamins and mineral content as it used to be. Also, vitamin C, like a lot of our other antioxidants in food, they actually start decreasing in quantity once we cut the plant. So for example, once I pick my orange, if I picked it a little prematurely because it has to make the whole truck ride and then stay on the shelf, then that entire time between when the orange was picked to when it goes into my belly, I have lost vitamin C along the way. The other reality is that because of things like crazy stresses, infections, environmental toxins, we are generating a heck of a lot more free radicals than we used to. We're talking 1,000 years ago. So to help quench or neutralize those free radicals, we need the extra vitamin C. So that's on that level. Also, vitamin C is really burned through. We burn through vitamin C in our stress response. Because as you probably know, what happens is every moment of every day, your senses are taking in your current reality. So what I see, what I smell, what I taste, what I feel, what I hear, that's all going into my brain. And then your brain has to categorize that information because it's always scanning for if there's a danger. That's how our nervous system works, and that's largely how we've gotten this far. And so when there's the perception, and that's the key word in mindfulness practices, so when there's the perception that you're experiencing a stressor, whether it's caring for an elderly parent, whether it's hitting traffic when you've got to get to work in 10 minutes, whether it's the multitasking, all of those can be perceived as stressors, then boom, the alarm goes off in your brain and a message gets sent to your adrenal glands, tiny little glands in your low back, and they have to respond by producing your go, go, go survival hormone, which is cortisol. And in the process of doing that, for your adrenal glands to make cortisol, it uses magnesium, which we're going to talk about towards the end, vitamin B5, vitamin B6, and you guessed it, vitamin C. Okay? So that's another way where we burn through our vitamin C really quickly because we're so stressed out and always perceiving stressors and producing those stress hormones. Otherwise, vitamin C, like it says on your slide, is really important for bone health and connective tissue health. So connective tissue being our ligaments, our tendons. So if we've got any athletes out there who are repetitively getting injured, maybe this is something that you want to consider. It helps our body deal with the different nutrients. And I really like this last point is that it helps to normalize our blood sugar levels. We are in a massive, massive pre-diabetes and diabetic epidemic. As you probably know, it is coming up in our youth. So younger and younger, we are seeing really high diabetes levels for reasons that I can talk to you about until tomorrow, but that's not the purpose of our talk today, but just know that that can be another way that it could help, okay? So given all of these functions of vitamin C, the question is, who should be supplementing with vitamin C? The short answer is pretty much everybody. But if we want to get a little bit more specific, then, and we want to go evidence-based, so looking at the research, because vitamin C has such an important role in the immune system and just gets eaten away by infection and stress, we see that we want to be using lots of vitamin C with coronary artery disease, asthma, the two different types of diabetes. Another really good indicator for maybe needing vitamin C, something to consider that you can talk to your healthcare provider about, is easy bruising. So if you're someone who just, knocks themselves on their table and then all of a sudden got a big bruise, or sometimes I'll have patients say to me, I wake up in the morning or I go to take a shower and I look down and I have no idea how I got the bruises that I have. What happens is vitamin C is really important to stabilize the blood vessels, especially the capillaries. The blood vessels are at the surface. So it helps to make them stronger and tougher. And so between helping your heart and helping a blood vessel in your leg, the vitamin C is going to be used more on the priority list. And so your blood vessel is less important. So then you're going to maybe see some easy bruising. So if that's you, then maybe vitamin C would be an indication for you. I'd see another question pop up. So Greg is asking, with the depletion of our soil, would I recommend fulvic and humic acid? And would these aid in the absorption of vitamin C? Give me one second. So Greg, I do use humic and fulvic acid in my practice. I never have come across any kind of information that helps with the absorption of vitamin C specifically. Maybe it does, but I've never seen that. I'll use fulvic and humic acid as a binder in the gut to minimize or decrease the amount of junk that we are absorbing from our gut into our system. All right, so what's the deal with ester C? Okay, so what we see that's really important, and Greg, this touches upon your comment about absorption, is what we see is that ester C is better absorbed. And so what makes it fancy, what makes it ester, is you've got the different metabolites that it includes on your screen. You don't, I mean, if you're a biochemistry aficionado, those three terms are really important. If not, then you'll have this in your back pocket to say, okay, I understand that these three things are what make up ester C, as opposed to just ascorbic acid or buffered ascorbic acid, or calcium ascorbate or magnesium ascorbate, which are the buffered forms of ascorbic acid, which is just straightforward vitamin C. So if we look a little bit more in depth into the studies, and why ester C is so important are the four different points that are on your slide. What we see is that ester C increases the function of your immune system for up to 24 hours after taking it. We're going to come back to this because I've got tidbit to share with you about that. Ester C is better absorbed and more quickly absorbed than the standard vitamin C. And I find that a lot of people who take ester C will quickly feel a little bit of an energy boost. And that, in my opinion, is a result of a number of things, including how fast it's absorbed. Okay. If you just take a regular vitamin C, maybe you'll find that that helps support your energy, but you're probably not going to get that quicker boost because of the absorption. It needs to be fast. So fast absorption is going to happen with the ester C. Ester C is gentle on the stomach. Regular vitamin C, as I've been referring to it as, is also called ascorbic acid. Hence it's acidic. So some people have touchy tummies in terms of having reflux or a little bit of inflammation in there, and so they may not be candidates for ascorbic acid because it might give them reflux or burning when they do take it. Okay. And then we do see that this is all backed by a lot of science. So let's go have a peek at the science. Okay. This is just great. So when we look at this study and you see the study that is referenced at the bottom of the slide, so you could always cut and paste or just jot that down or take a photo of it if you want to actually go and look at the study. But basically the conclusion is the following. Ester C helps to reduce the frequency and the duration of the common cold. So it'll cut it almost by half. And this is with just 1 gram or 1,000 milligrams of ester C a day. That's bupkis. You know, that's a really, really, really small amount. If I've got people coming down with symptoms of a cold or flu, then I will invite them to consider to take 2 to 3 grams 2 to 3 times a day. Again, that depends on your health conditions, so you do need to check that with your healthcare provider. But in this study, they just used 1 gram, and that cut the duration of having common cold symptoms from 3.1 days to 1.8 days. I think that's pretty good and pretty worth it. Okay, so this is one that I find really important. So what you see in this study is they're looking at ester C and they're comparing it to other types of vitamin C. So you'll see the blue is ascorbic acid, which is the regular vitamin C that we've been talking about. The green is placebo. You've always got to do it controlled to make sure that we don't have the placebo effect, because there's not anything wrong with the placebo effect, but we don't want that to influence the results. By placebo effect, I mean that idea of you want it to work, you believe it's going to work, so then it's going to improve the outcome. Don't forget that pharmaceutical drugs have a 30% placebo effect. So it's not just about vitamins and minerals and supplements, it's about the power of the mind, okay? And so what we see in here is the following. Ester C, within 2 to 3 hours, okay, is going to increase your white blood cells, and then it's going to keep it up for 24 hours. So compared to the blue line, which is a regular kind of vitamin C, which will boost your immune system, not as strongly, right? Because the blue dot is lower than the first orange dot, but it will do it in about 2 hours. But then look at what happens after it hits that peak. It comes right down. So before I got turned on to Ester C, what I would do is anytime I was feeling a bit of a sniffle, I would definitely load with vitamin C. But what I would notice is that I would need to take the vitamin C every 3 to 4 hours, because I would take the vitamin C, the regular kind, even powdered, to get it to act faster. And I would notice, oh, I'm feeling a bit better. I'm feeling less cold and flu, less of that brain foggy feeling of just, oh, I'm not feeling so good. My head is, really foggy, and I'm feeling the sinus issues come on. And that clarity or that improvement would last for about 3 to 4 hours. Then I would slowly feel myself slumping back, and so I would take another dose. So I would be dosing with vitamin C every 3 to 4 hours to try to get that improvement maintained or get it back. When I started using Ester C, what I noticed is I pretty much needed to do one dose, and it would last me for pretty much most of the day. So that is extremely cost effective, and it's going to increase your compliance, because instead of needing to take something every 3 to 4 hours, you're doing it once, twice a day, and that's it. Okay. All right, so Greg is asking, so that you don't unnecessarily pee excessive vitamin C. How much vitamin C? What are the upper limits? Again, so what I'm going to invite everyone to consider is that this is a general talk about information. This isn't about what should you be doing for yourself. That requires personalized care. I don't know what your health conditions are. I don't know what meds you're taking, and it is not time to put that for me in the chat. That is something that you can discuss with your healthcare provider. Generally speaking, I've given you some notions of dosing. When we're looking at this study is saying 1 gram a day. For people who are having cold and flu symptoms, sometimes I will recommend that they consider doing 2 to 3 grams 2 to 3 times a day, but that's during an acute time. I'll use vitamin C for a whole other number of reasons, whether it's for bigger infections where I'm using the liposomal form of vitamin C, or maybe we're using the Ester C packets that we're going to see in a few slides as electrolytes, and maybe they're doing 1 or 2 of those a day, depending on their exercise level, sweating, if they're using a sauna. So there is no cookbook medicine, okay? We don't open a recipe book and say, okay, everybody needs to be taking this amount. It depends on the case. It depends on your underlying health issues, and it depends on what we're trying to achieve. Okay, so I will invite you to keep asking questions, but I am going to ask for them to stay in a non-personal about you way. And if those questions are asked, then I'm just going to skip over them, because I can't give that kind of information when you're not my patient and I don't know what's going on with you. It would be unethical and irresponsible. Okay, so thanks for hearing me out about that. All right. Next study is we're looking at using Ester C as opposed to the regular vitamin C called ascorbic acid on people who have sensitive tummies. So what you see is that the individuals who have sensitive tummies who use Ester C is that they can tolerate it much, much better. So like I said before, I will sometimes use ascorbic acid or vitamin C with individuals, and they can come back and say, that burns my stomach, that gives me real abdominal or digestive discomfort. And it's because they need the Ester C. They'll probably do much better with that. All right, what else have we got in terms of studies? Right, there's often a lot of press about vitamin C contributing to kidney stones because of how they can promote the excretion of oxalates, okay? And how, I'm not sure if it's the majority of the stones are calcium oxalate. I think so. We can have different types of kidney stones, and I think the most common kind are calcium oxalate stones. So if you're someone who is predisposed to making stones, or you have a history of kidney stones, and you have done some kind of online search, and you think that vitamin C is not a good idea for you because it could contribute to oxalate stones, well, what you'll see in this study that's in front of you is that that's not the case with Ester C. So another good reason for it. All right. So when we're looking at how much maybe Greg, this will help answer some of your questions. When we're looking at the two different types of vitamin C, ascorbic acid or L-ascorbate in this study, or ester C, what we see is that the body holds on to the ester C much better. And I think that's a large part of why it can boost the white blood cell count and then keep it up, right? Because the body's going to hold on to it as opposed to drinking it or swallowing it down, absorbing the ascorbic acid. It helps for a bit and then we pee it out, right? So the ester C is going to have a longer acting time in the body and it's retained in the body for longer. And you have the studies there to show it. All right, so this is my favorite. This is my favorite kind of ester C supplement. I think it's awesome. It comes in a few different flavors. This is the citrus. I think there's orange, lime, and I believe berry. And one packet, which I think tastes really good, is 1 gram of ester C vitamin C. And then you have, it kind of acts like a bit of a multi, right? So then you have a number of the other nutrients. And what you're going to see is that there's a good amount of phosphorus, calcium, magnesium, which can really help to serve as an electrolyte packet as well. And because of the good taste and because it's really easy to take, you can just add it to water bottles. So if I see that my kids are starting to come down with a cold or flu, or that they're not feeling great, or they're going to school, but they've got the sniffles, you see it in their eyes and their face, then I'm probably going to put an ester C packet of the energy boost in their water bottle. So this is something that's really easy and it tastes good. That's got the berry flavor and that you've got the lime flavor. And what's great is that it tastes really good and there's very little sugar. They'll have anywhere from 3 to 4 grams of sugar per packet, depending on the flavor. All right, now we're going to look at the whole sleep stress piece and how that can impact our immune system. All right, so melatonin. Melatonin is a fantastic thing. Melatonin is a hormone that is produced by your pineal gland, also known as your third eye on that level. And it's just right behind here. And the pineal gland, what it does is it regulates, it's a large part of what regulates our circadian rhythm. So that's a fancy couple of words that basically means every cell in your body has a 24-hour clock. It has a time of when it likes to act, repair, sleep, be dormant, detoxify, whatever it may be. Your body has a clock and a rhythm. We've evolved that way with the sun and the hours of day and night, so that those two things are in harmony. The rhythms in our body of when our different organs and cells should be doing what action is actually connected with whether it's light or dark out. For obvious reasons of modern day technology, as in it's 7:40, it is pitch black outside in Montreal, and we are looking at a screen and under bright lighting, we no longer follow the circadian rhythm schedule, right? So part of what that does is that really messes with our melatonin production, because your pineal gland knows if it's light or dark out because it's connected to the optic nerve. So the optic nerve goes right into the brain and feeds into the pineal gland. And when there's light coming in, that tells the pineal gland, no, don't produce melatonin. When it gets dark out or as the lights start to dim, then that absence of light tells the pineal gland, yes, it's time, start building your melatonin. So that's why some circadian rhythm practices can be really helpful at setting that internal clock. So some of what I'm going to share with you, I want to give credit where credit is due, is by Dr. Andrew Huberman, who's a neuroscientist down in Stanford, and I'm sure a lot of you have heard of him. He's really put a lot of this information in neuroscience and functional medicine on the map. So basically what I tell patients what I invite them to do to help with their circadian rhythm is the following. When you wake up in the morning, within 30 minutes of waking, you want to be exposed to bright light for 5 minutes minimum. That bright light can mean going outside, even if it's raining, snowing, overcast, you're still getting the UV information. Or if you need to be waking up and packing breakfast and lunches and all of that stuff, then you want to have a really bright overhead light. It does not come through the window. So your kitchen might be basking and bathing in sunlight that's coming in through the window, but that's not what your pineal gland is going to register. So what I do personally is when the mornings are dark like this, what I do is I will come downstairs and I'll start to prepare the breakfast and the lunches underneath the oven hood with the lights on. So that's really bright light. So that is communicating to my brain daytime. And then throughout the day, whenever you can, even if it's for 30 seconds, pop your head outside. So if you are going to check your emails, just go stand outside and do it. I understand that that can be really challenging for people who live in high tower apartment buildings, for people who work in high towers, but whenever you can, pop your head outside through a window or through a door. That's giving those signals to your pineal gland that it's still daytime. And then once it starts getting dark in the evening, the idea is that you dim your light. So you start dimming your light, you avoid being in front of a screen, and then when it gets time for bedtime, the lights are as dim as possible. And if you want to be reading, you're reading from a paper book and not from a screen. So those are all suggestions that can help get your circadian rhythm back on the rails to help with your energy, your sleep, and what we're here talking about today, which is your immune system. So melatonin is incredibly important, transitioning us from stage 3 to stage 4 of sleep and also helping to fall asleep. Okay. So what you're going to see here is what's really interesting is that when melatonin is at its highest, or when it's supposed to be at its highest, then you're at about 1 in the morning, then you're supporting the group 1 of our seesaw that helps to boost the immune system against viruses. When you have healthy stress levels at 8 in the morning is this a nice peak of cortisol, your stress hormone, that's supposed to support the group 2 of your immune system so that this can stay in balance. Okay, the more we can maintain that balance, the more we can have a healthy immune system, whether it's dealing with cancer cells, inflammation, or colds and flus. So manage your stress and get your sleep is the punchline there. Okay. So this is revisiting the same graphic, and then this is just honing in on that group 2 that we talked about. Oops, there goes my pen. That group 2 that we talked about, and that group 1, and that seesaw. And so when it, and many of us are living here, this is part of the conundrum of our modern day social health crisis, is that we're too vulnerable and not effective at dealing with viruses, and our immune system is just, it's pulled the fire alarm, or it's got the button on the fire alarm for inflammation on a kind of constant basis. Okay? So melatonin. Melatonin is something that you can very, very safely supplement with. Melatonin is not habit forming, which is a very big question and a good question. So I'll get asked, okay, well, if I start taking melatonin and I start sleeping better, then am I going to become dependent on it? No, as in it does not override your body's production of melatonin. However, if you don't address the lifestyle challenges that are causing or contributing to your insufficient melatonin production, then when you stop taking the melatonin, you're going to go back to not sleeping because you haven't solved the problem. So that being said, melatonin is super safe to take all ages. It is incredibly supportive to the immune system to fight infections. I often use it in my cancer protocols, especially with women with certain types of breast cancer and other types of cancers. And it can be really, really effective. So here we've got some by Sisu, where it has different ranges. So you can find a 1 milligram, a 3 milligram, you can find a 5 milligram. That's what we have here by the Sisu bottle. There's a 10 milligram, and then there's also the liquid. So that's great for kids. You can just dose a tiny little bit at a time. Okay. Now, the other thing to keep in mind is that melatonin, we saw it before. Let's see if I can get back to it. So like it says here, the second line, melatonin helps to initiate the onset of sleep and to transition from stage 3 to stage 4. This is giving us a heads up about 2 different kinds of sleep problems. Some people may have insomnia because they can't fall asleep. Other people will have insomnia because they can't stay asleep, or other really lucky individuals have both. So if it is taking you longer than 20 to 30 minutes to fall asleep, then that's taking you too long. You can say, oh yeah, but I like getting into bed and I read my book for an hour and a half, and then I turn off my light and I'm asleep in half an hour. Great. If your lights are turned off and you want to be getting to sleep, but it's taking you an hour, I have patients where it takes them 2-3 hours, that's clearly insomnia. So that is where the melatonin that we just saw could really be helpful. You take it 15 to 30 minutes before bedtime, some maybe even up to 60 minutes before bedtime, and it can really help bring on that sleepy feeling with the heavy eyelids, and off you go. Other people, it's that they wake up in the night. And that is where you could also use melatonin, but it's a different type. And you'll find this probably in your local health food store. I'm sure Healthy Planet employees can help you find it, is that it's the sustained release, also called time release, also called prolonged release type of melatonin, where you swallow it and over the night, it's going to slowly get released into your system. So that is going to help the individual who's having a hard time transitioning to the deeper levels of sleep, and instead they wind up waking up. So just keep those two in mind. Also, I just want to share with you that I've had many patients tell me, oh, Paula, the melatonin I get from your dispensary, like the Sisu or Douglas Labs or Pure Encapsulation brands, do great for my sleep. So then I went to the pharmacy and I just got the stuff off the shelf, and it really didn't help. So I've gone back to the professional brand or the kind that you have recommended for me. So just like not all vitamin C's are created equal, not all melatonins are created equal. I'll let you have a peek at this slide while I just have a sip of water. And I've got a question. Let's make sure it's not IT related. Okay, so Greg, I'm going to say it again. I cannot answer your personal question. You're asking if you can take melatonin with other sleep aids. I don't know what those sleep aids are, and this is not the appropriate platform to be asking that information. You need to speak to your health practitioner about that. It depends on what other meds that you're taking. It depends on what other supplements that you're taking. Generally speaking, melatonin does not have any big, huge contraindications, but that is something to consider with your healthcare provider. All right, let's move on. So this slide basically talks about all the things about melatonin that we've already talked about. So let's move on. If we need some other kind of sleep support that is not just about melatonin, I really love this product. So this is a lovely powder, also made by Sisu, that's got key relaxing ingredients. So we've got magnesium, L-theanine, and GABA. So as we know, magnesium is muscle relaxant. So people with heart palpitation, constipation, muscle cramps, muscle twitching, insomnia, anxiety, they may be a good candidate for magnesium, and that's something they can talk to their healthcare provider about. One serving has a nice dose of magnesium of 250 milligrams. This formula also has L-theanine. L-theanine, think of it as the opposite of caffeine. Okay, so caffeine is very yang, it's what gets you hyper and revved up, and L-theanine is what chills you out. So just to give you an example, a lot of people will use caffeine coffee to obviously boost them and that they'll feel that caffeinated feeling. However, that same individual may not get that jolt feeling from green tea but green tea contains caffeine because green tea also has theanine, which helps to balance out that jacked up feeling from caffeine. So theanine is really calming. And with regards to sleep, it helps to increase the alpha wave of sleep, which helps to promote a deeper sleep. GABA is awesome. GABA is a neurotransmitter in your brain that basically makes you feel like life is good, you're at peace, and there's nothing to worry about. So the three of them combined together is really quite lovely in this powdered mix that you can consider taking at bedtime. All right, let's have a look at a case. All right, so Greg, I just answered your question with general contraindication. We're good to go. Okay, so here we've got Ari. Ari is a 42-year-old working single mom. She's got super duper stress levels that are high. She's got a hard time sleeping. She often gets sick because she's run down. And, you know, if she's a mom, then she's probably got kids bringing all kinds of fun stuff home. And she just doesn't have time to be sick. So she's currently taking a probiotic that's got some vitamin D in it. Just a little plug here, HMF Fit for School is an awesome probiotic. You don't have to be a kid to take it. It's got great probiotics, the 4 core strains of HMF, and it's also got 1,000 units of vitamin D. So her ND had already prescribed that for her, and she tends to drink lots of coffee, and she doesn't take any medication. So before we look at what are things that could be applicable for her immune system to relax because she's really stressed out and to help her sleep, I just want to have a little comment about coffee. As you can tell from my name, I'm very Italian. And so coffee is something that I've been raised with. I mean, I love coffee. Unfortunately, I don't drink it anymore for my own personal reasons, but I think coffee is fantastic. So this isn't to diss coffee. However, another tip from esteemed neuroscientist Dr. Andrew Huberman is the following. If you drink something caffeinated within 90 minutes of waking, then this can be largely responsible for an afternoon crash. Okay? We don't have the time to go into all of the biochemistry about it. Take my word for it, or you could look up Huberman, coffee, delay, coffee crash, and he'll give you the explanation. It's about adenosine and how it binds in the brain and blah, 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 blah. Anyways, we've got to move on. So if you find that if you're a coffee drinker within 90 minutes of waking, and you do find that you crash in the afternoon, which makes you more vulnerable to catching colds and flus, right? Because during that crash, your whole system is more vulnerable, you're on low energy, chances are you'll go and gravitate to some sugar or some coffee, which can further weaken your immune system. So what you may want to consider doing is still have your beloved coffee, but delay it by 90 minutes. And in the meantime, if you're really attached to drinking something coffee-like in the morning when you wake up, then there are a bazillion of alternatives that I'm sure you're going to find in the aisles of the Healthy Planet, whether it's a curcumin and ginger, whether it's a mushroom, whether it's a chicory barley substitute, and you can add boiled water or warm up some nice plant-based milk, like an oat milk, vanilla flavored, and have that in the morning on waking, and then have your coffee about an hour and a half later. All right, back to Ari. So here are some things that we would want to maybe consider for her. The magnesium 250 that's got the GABA and the L-theanine, she can actually take that during the day. So she can take that in the morning to help set the stage for being a bit more chill. She can even do half a dose in the morning and half a dose later in the day to help keep those anxiety levels low, keep her just grounded and chill and not spinning out. She can use the melatonin to help her fall asleep, and then she can use her little ester C packets in her water bottle to help support her immune system. Great. Now we're talking about having a run nose. Well, there's no fever, there's no major systemic symptoms because he still has an appetite and energy, but we want to be proactive. Okay, so one thing that's really super duper important are nasal rinses. So we learned this with COVID, is that a lot of these viruses are going to actually enter and attach themselves into the nasal tissue, and that's how they make their new home, your body, and infection ensues. And so what I'll do, especially this time of year with myself, with my family, is we'll just do a daily nasal rinse so that you can work on flushing out anything that may have hooked its way in there during the day. And of course, if you're having symptoms, then doing nasal rinses, steam inhalations with some essential oils can be really great. Another thing, if there's a lot of congestion in the nose and in the sinus area, is you may want to take out wheat, dairy, sugar, bananas, and soy for at least a few days until the symptoms resolve, and then a little bit after. And then you've got your, healthy immune boosting kind of drinks things like ginger with honey tea. That's great for kids with some cinnamon. Those are all kinds of different DIY at home options. Otherwise, we've got cold and flu rescue for kids. What's really great is that they're chewable, right? So we need stuff that's easy for kids to take so that we're not traumatizing them. And so we've got in this one, it's only 100 milligrams as opposed to the 1,000 milligrams, but Ari's 4. So he doesn't need necessarily as much as adults do. So this is something that he can chew on. It's the ester C type. We've got some echinacea and some zinc, vitamin A, which is really a wonderful antiviral. So this is a formula that Ari can take as soon as he starts feeling any kinds of symptoms, and he can take 1 tablet 3 times a day. When patients ask me, well, how long do I do this for? I say, keep taking it until symptoms resolve, and then tack on another 3 days or so, right? So that we really kick it out and it doesn't come back. These are suggestions that can be considered for this type of situation for kids. So we have the chewable cold and flu rescue that we just saw. We've got a chewable ester C at 250 milligrams per chewable, and we also have vitamin D. So a main question is, how much vitamin D should I take or should I be giving to my kids? There is no standard dose. I never understood how we got to 10,000 a week for an adult prescription. That when you do the math, it works out to 1,428 units a day. Most adults need more than that. So the vitamin D that you need in a day is really based on your blood test results. Okay, so that's where you want to talk to your healthcare provider about getting your vitamin D tested, and then from your results, figuring out what would be a good daily dose. That being said, the federal government within the past couple of years actually increased the recommendation for children above 9 to 2,500 units a day. Okay. All right. So we've also have cold and flu rescue for kids, and we have it also for adults. So going to leave that with you. What's great about the one that's for adults is that it contains NAC, N-acetylcysteine. N-acetylcysteine has a boatload of research behind it on how it's antiviral. Its claim to fame really exploded during the bulk of our pandemic because a lot of research has come out of there that actually N-acetylcysteine is a great antiviral. It's a great mucolytic. A mucolytic is something that breaks up mucus. So you've got that wet cough, NAC is a great thing to take. It boosts the immune system. It helps to relieve chronic bronchitis, probably because it acts as an anti-inflammatory, an immune booster, and breaks down that mucus. Okay, so this is something great to have on hand if you tend to be someone with those chunky coughs, for lack of better words. All right, the last thing that I'm going to touch upon is zinc. Very, very big fan of zinc. Also, tons of research, not that there was a need to do more. We knew that zinc was a great antiviral and immune support with tons of research, but even more research came out through the pandemic and after of how important zinc is as an antiviral. So what we've got here are these lozenges. These are gel caps. So this is 30 milligrams in a gel cap. We also have Atrium that you'll find at your Healthy Planet also has zinc lozenges, which I find really helpful if there are a lot of sore throats. So I'm definitely a really big fan of zinc for boosting the immune system as an antiviral. It's lovely for the skin, really helps with acne and acne scars, eczema, psoriasis, that kind of stuff. You don't necessarily want to take it forever and ever because there's a whole sensitivity with a balance between zinc and copper. If you do want to consider taking zinc long-term, talk to your healthcare provider about it. All right, it is exactly 8 o'clock. We are done. Thank you so much for your participation. I'm going to open up the Q&A. I see a couple of more questions have come in. I'm going to see if there are questions that are relevant in terms of what I can answer within my ethical scope. And I definitely want to give you a big thanks for your participation, for attending. And I really hope that you're able to take away a couple of pieces from today. I wish you great health and safety, especially during this cold and flu season. And what you do want to do, what I would invite you to do, is to be prepared. So I would invite you to, based on some of the things we talked about today, based on your conversation with your healthcare provider, maybe you want to get yourself a little arsenal so that you're ready for if and when cold and flu symptoms start. If you're at the office or it's 10 o'clock at night and you're getting into bed and you're saying, oh, I'm starting to feel something, you immediately want to have something on hand to nip it in the bud. It's the way to go. All right, let's have a quick look. In the chat. Oh, great. I'm so glad you enjoyed it. Wonderful. Thank you for the positive feedback. Let's see what else we've got. Anonymous. Hi, Anonymous. I'm Paola. Is magnesium bisglycinate the same as magnesium glycinate? Yes. The difference is just there to confuse you and me alike. Same thing. Okay. With all the press on vitamin D being fat soluble, is there a max dose? So I answered that question already, Greg. That is to get your individual dose, you do need to get your blood test and base it from there. So is there an absolute max dose? No, it's going to depend on what your needs are. Okay. And Mr. and Miss Lee, Lee, can ester C be taken at any time of the day? Technically, yes, but I would shy away from it in the evening because it does boost the energy a little bit. So I would shy away from it in the evening. I would definitely hit it in the morning and in the afternoon, if not the early afternoon. And another question, when taking vitamins and supplements, do we need to take a break from taking them? It depends. It depends on what vitamins and minerals and different supplements that you're taking. If you're taking a B complex and that really does good for, that was terrible English, and if your B complex really does well for your mood, your energy, your PMS, your skin, and you find that it really helps, there's no issue with taking a B complex long term. Like I mentioned about zinc, if you like taking zinc, then you're going to want to talk to your healthcare provider about it in terms of taking it long term, because there is a delicate balance with copper that needs to be maintained. Something like vitamin A, you definitely do not want to take that long term. So it really depends on what it is that you're taking, and then again with your individual health needs. So I wish you all a lovely rest of the evening. Thanks again, and hopefully till next time. Take care. Bye-bye.